Thanks for joining us on Chicago Tonight. I'm Brandis Friedman. Here's what we're looking at.
I think there's been a lot of misinformation about the options that are included in this budget.
The latest on Chicago's budget negotiations with the city's budget director. And as the Trump administration chooses not to commemorate World AIDS Day, a look at where prevention efforts stand. First off tonight, faith leaders are pushing back on rising property tax bills. It comes after a recent study revealing 9 neighborhoods on Chicago's south and west sides where the median residential property tax bill increased by more than 50%. Clergy members today called out the impact they say these increases will have on residents who can least afford it.
These astronomical property taxes, they're not just numbers, but actually we see them as eviction notices. These numbers translate to foreclosure. It translates to homelessness, it translates to displacement and the destruction of generational wealth.
The clergy members are calling for immediate relief for impacted homeowners and answers from the Cook County Assessor and Board of Review. For the first time in 24 years, Cook County's Circuit Court has a new chief judge at the helm. Judge Charles Beach II took the oath of office today.
We will not achieve perfection, but we will strive for consistency and integrity. We will be guided by the wisdom of our history and anchored by the virtues of justice, fairness, and kindness. My friends, the work begins now.
Beach replaces Chief Judge Timothy Evans, who'd been in the position since 2001. During his remarks, Beach echoed some of the lessons learned from previous chief judges and outlined his own governing principles of justice, fairness, and kindness to others. Beach was elected to the role back in September, defeating Evans by a vote of 144 to 109. Chicago's winter overnight parking ban is officially in effect. That means parking is restricted from 3 to 7 a.m. across parts of the city's 107 miles of main streets, so be sure to check for those posted signs. The Department of Streets and Sanitation says the overnight parking ban allows snow removal crews to plan and execute operations more efficiently. The ban remains in effect until April 1st, whether or not there is snow on the ground. And city crews may need it tonight because another couple of inches are expected to fall in the Chicago area. The National Weather Service says we can expect 1 to 3 inches and has issued a winter weather advisory through midnight. This after historic snowfall over the weekend. 8.4 inches reported at O'Hare on Saturday, setting a new record for a single day's snowfall in November. But guess what? Weather Service says after moderate temperatures on Wednesday, it's going to get really cold later this week. Yes, that's sarcasm. Highs between 8 and 16 degrees, wind chills 10 to 20 degrees below zero. Up next, there is a showdown brewing at City Hall over the budget. City Budget Director Annette Guzman is here to talk about it right after this.
Chicago Tonight is made possible in part by the Alexandra and John Nichols family, the Polk Brothers Foundation, and the support of these donors.
The clock is ticking as Chicago City Council has just a month to pass a budget for 2026. Last month, the City Council's Finance Committee refused to advance Mayor Brandon Johnson's proposed spending plan. A major sticking point centers around a plan to impose a so-called head tax on large companies. With the Thanksgiving holiday over, the pressure is on to reach a deal before the end of the year deadline. So joining us now is Annette Guzman, Budget Director for the City of Chicago. Welcome back. Thank you for joining us.
Thank you for having me.
So, second year in a row, it's coming down to the wire. I remember talking to you about this just a year ago. What do you see as the main sticking point here?
You know, I think there's a lot of discussions around how do we appropriately fund the government? How do we make sure that services that are critical to the day-to-day lives of residents of the city of Chicago, businesses in the city of Chicago, as well as people who come to visit our city every single day. How do we ensure that we're properly providing for those while also ensuring that our city stays safe, that we provide ample opportunities for those who want to move and live and work here. And so those are really important conversations that are happening and that we need to happen. And unfortunately, the city of Chicago, because we're a municipality, have very limited options around what it is that we can produce as it relates to revenue to support those services.
So before the Thanksgiving holiday, you and the mayor, you charged alderpeople who oppose the mayor's budget to come up with one of their own. Have you heard or reviewed any of those proposals, alleged proposals?
So, you know, what we have heard are sort of reactions to what the mayor has proposed, right? So we've had alders who've asked us to look at things slightly differently, adjust things. Could we do it this way instead of that way? Are there, you know, tell us more about the work that we did over the last several months, 7 months to 8 months, looking at operations. How do we make efficiencies? Tell us why we can't get more of those savings into next year's budget as opposed to future year budgets. So those are the conversations that are happening. As I said before, you know, we welcome those conversations. We've been having those conversations, frankly, all year. Obviously, a little bit more pronounced and acute now that we're sort of down to the wire. But that's really what we've heard from. This isn't the first time we've asked alders for their ideas. This isn't the first survey that we've put out to alders this year. But I think the urgency of the moment is, you know, upon us, given that we do have a statutory deadline.
So then does it feel like from alderpeople who oppose the budget, you're only getting criticism and no ideas, no suggestions?
Well, I will say that, you know, I am a lawyer by trade, so I am a person that likes to solve problems, right? I look to sort of sit down and see, you know, where is there movement, where is there room for us to come to a compromise, rather than just identifying the problem, right? And so for me, we have had really good conversations helping people understand how we got to where we were in the budget that we did present. And we have seen some movement once, you know, some of that understanding was there, that sort of groundwork was laid, a little bit of an understanding of like, okay, now I understand why this is the option that you put before us in City Council. We still had others who've continually pushed back. And again, I always say, how would you like us to resolve that issue? If you don't like what's been put before you, how would you like to see? You know, we keep hearing efficiencies, we keep hearing cuts, but what we don't hear are specific cuts. We don't hear what are you willing to, you know, go back to your residents and say, we're going to do a little bit less of that next year.
So one of those alderpeople, Alderman Bill Conway, who voted no on the mayor's revenue package, he argued here 2 weeks ago for implementing more cuts that were outlined in that report from the accounting firm Ernst & Young. Let's take a look.
And that's why we have to be efficient with taxpayer dollars. And the report had some clear places to do that. For example, fleet optimization. The average car owned by the city is driven 7,000 miles a year. 7,000 miles a year. And Ernst & Young said we could get $29.6 million in efficiency in year one. There's $3 million of that in the budget. Procurement. Only 51% of the stuff that we buy goes through the procurement department. They identified $55 to $111 million of savings we could get through that. Only $10 million in this budget.
So you've said that some of the cuts that are recommended in that report will take years to see some of those savings. Say more, please. Explain.
Yeah, and you know, I've sat across from Vice Chair Conway and have always said, if you have questions, if you want to dig deep, my door is always open. My phone is always turned on. I'd be happy to walk you through what that report actually says. In that report, it never says what year one is. It says in the first year of full recoupment, this is what you could expect. There's a lot of groundwork that we have to lay to get to year one and a lot of those recommendations because they're a new way of operating for the city of Chicago. They're absolutely right that you know, if we had fleet optimization and we had a lot of the groundwork in place right now, for 12 months of the year we would be able to recoup potentially $20 million in savings. But there is a ton of groundwork in how we shift how we operate to get there. And those are the conversations that we have with our departments. We sat down after every single option was put on the table and we said, do you have the things in place to actually get to that level of savings? Is our year one for this 2026, or is year one 2027, 2028? What are the technology that we need to have in place to be able to track our fleet, to be able to understand what the actual utilization is year over year? What is the performance that our departments are having? As I said to the alder during the budget hearing about procurement, departments don't have the same procurement authority as the procurement department. It's not as if they're all out there buying the same things. City Council over the last 30 to 40 years has given very specific and limited authority to other departments under city ordinance to procure specific and limited items within their departments that have nothing to do with what procurement services has. And as I said to City Council, we can delve into why this body gave those departments specific procurement authority, but that's going to take time. And it's also going to take time to shift our operations and our systems to be able to get more towards what we think is best practice.
So another point of discussion was the mayor has said that he would veto any budget that cuts the Chicago Police Department. At $2 billion, though, is there no way that CPD's budget could be trimmed without reducing officers? Because he has expressed, obviously, that is important, that does not happen.
Yeah, so I think it's important to note that, CPD is about 1,000 to 1,500 less officers today than it was 4 years ago. And, in this budget, what we have done is worked really collaboratively with the superintendent and his senior staff to understand what are your hiring goals based on the coverage that you need today to both staff the district, the fact that we do have a lot of people who are on medical leave, the fact that we do have a lot of protests that happen in our city right now, the fact that we do have a lot of special events that require police presence, and we're working towards making sure that we're recovering more of those dollars, but we don't have that system in place today. And so with all of that confluence, oh, and I forgot, we're also under consent decree, right? So
who could forget that?
Right, and the consent decree isn't just about civilian positions, it's about how the police department and the officers themselves conduct their operations. And so with all of that confluence, we worked really closely with Superintendent Snelling and his senior staff to understand what is a reasonable amount of hiring that you're going to do to keep up with the level of attrition that you have and making sure that where we are today, we're not going below that. We froze all of the other positions. So we've already implemented cost savings on CPD's budget in 2026 below what their actual position vacancy count is. So we've taken all of that into account, and we've put in front of City Council a management ordinance where we're sharing responsibility that says we're going to be upfront with you. We've told you how much overtime that we're going to limit them to, and we're going to force them to come back to you if they need to go over that. We've put in front of you quarterly and monthly budget monitoring reports that CPD has to give to City Council on a monthly and quarterly basis. And we also have asked in that ordinance that they also update you on the implementation of the medical audit so that we can get officers back into their work that we hired them to do. They have a transition report on civilianization that's due next year so that we can get more officers away from doing administrative tasks. And they also have to report out on a quarterly basis on an early warning system, which ultimately helps us actually reduce the number of settlements and judgments, which is another big sticking point in this budget as well. So we're putting all of these things in front so that we can start to shift how CPD operates, shift how we budget for them, but it won't be done overnight because it didn't get like this overnight.
You didn't arrive at this problem, this shortage overnight. Okay,
Right.
That's where we'll have to leave it. Obviously, we'll be keeping an eye on this the next couple of weeks. City of Chicago Budget Director Annette Guzman, thank you so much for joining us again.
Thank you.
Up next, a look at how local advocates are commemorating World AIDS Day. For the first time since 1988, the U.S. is not publicly recognizing World AIDS Day. This follows significant cuts and structural changes to both domestic and global HIV and AIDS funding since President Trump assumed office, which the United Nations warns is causing significant global risk. Public health officials say in Chicago alone, more than 22,000 people are living with HIV/AIDS, and more than 700,000 Americans have died from the disease since 1981. Joining us with more are Dr. Maya Green, founder of Nexus Medical Care, a platform specializing in HIV prevention and treatment under Onyx Health Collective. She's also on the board of Cook County Health and Hospital Systems. Dr. Anu Hazra, Associate Professor of Medicine and the Infectious Disease Fellowship Program Director at the University of Chicago, also a practicing physician at Howard Brown Health. And Manuel Hernandez, I can talk today, you guys, the Executive Director of Alma Chicago, an organization that advocates for the Latinx LGBTQ plus community. Welcome back, everyone. Thank you for joining us.
Thank you. Thank you for having us.
First, I want to ask, we've celebrated, or this day has been commemorated as World AIDS Day since 1988. What does this day mean to you? Manuel, I'll start with you first, please.
I believe this day is a remembrance of the individuals whose lives we lost many years ago, and those who are still fighting for equity, still fighting for health care, still fighting for equal opportunity. And so that's what today means for me.
Dr. Hazra?
Yeah, I mean, to echo that, I think it's understanding where we came from and the work that's still left to do. It's commemorating our past, but also looking forward at our future and trying to figure out how to develop a future that is free of issues that are obstacles of our patients living with HIV accessing care, or those vulnerable to HIV accessing prevention.
Dr. Green?
Today it was about continuing to move the needle in the direction of our individualized missions, but moving collectively. Also at a time like this, today is about resilience.
So let's talk about that. What was your reaction when you learned that the Trump administration wouldn't be acknowledging World AIDS Day?
Well, it's the politics of memory, right? So I wasn't shocked, I was disappointed. Like historically, things like this, depending on who's in power federally, these days will start to drop off. It's the politics of memory, but it's to change the narrative, because if you stop commemorating it, you get to rewrite the narrative historically, pull resources back, and cause disruption.
Dr. Hauser, what does it say to you that the administration has made this choice?
I think it is, again, not surprising based on the actual actions of this administration. I think it is completely disheartening and, again, quite unprecedented, but we are living in ongoing unprecedented times. And I think it really shows the cards of the administration really not caring about the people living with HIV or those vulnerable to HIV, not just in the United States, but globally as well.
Manuel?
Yeah, I echo the same feelings as Dr. Green. It's rewriting of the narrative, it's rewriting of history, and it's ignoring the individuals, our communities that disproportionately are affected by the virus. It's done intentionally. It doesn't, unfortunately, surprise me.
Dr. Hazra, so PEPFAR, that's the President's Emergency Plan for AIDS Relief, and the President, as in it stands for whoever is in the White House. That's the U.S.'s global HIV/AIDS program, and it is reported to be winding down with plans to shutter over the next couple of years. Help us understand how fighting HIV/AIDS abroad impacts us here.
I mean, we live in a global society. Pathogens, infections, HIV, other emerging pathogens don't have passports. They don't observe borders. Ignoring an outbreak or some sort of major pathogen that might be emerging in a part of the world just because it's not in our border yet is quite foolish and really short-sighted. PEPFAR has saved tens and hundreds of millions of lives globally. It was a bipartisan act done by George W. Bush. And completely as cited as one of the most powerful and productive sort of collaborations globally that we've seen to date. And it's not just shuttered, it was completely outright stopped, and it was only after activism to actually start to include pregnant persons and understanding the implications of HIV and pregnancy globally is why they finally restarted the program in its shell. But it is tantamount to complete destruction and quite literally wiping out another entire generation of people with preventable deaths across the world.
Manuel, Chicago's been dealing with, we know, increased and aggressive immigration enforcement over the last few months under the Trump administration. How would you say Operation Midway Blitz has impacted the Latino and the LGBTQ plus community with getting access to health care?
Yeah, I'd say it has affected the community dramatically. When you pair, right, having to leave your home and the fear of leaving your home, even if you are documented, there's still the fear of you're going to be targeted. And so individuals are less likely to seek care. And so it also is up to the organizations that are doing the work in partnership with healthcare partners on how do we access these individuals. And so we will see an impact on how the ICE raids in the city affected how individuals engage with healthcare professionals.
Are young Latino men particularly vulnerable to new HIV infections?
Yes.
Tell me why.
So Latino and Black men, right, make up the majority of new HIV infections in the city and globally, and right throughout the United States. And so what we are seeing is, right, these individuals are younger, and so the more younger populations are the ones that are coming up with new diagnosis. And so it has to be targeted towards them because we are seeing individuals and the compounding factors, right, that also play in that. If you're younger, right, education, your immigration status, housing, food insecurity, all that plays a part when it comes to, right, an individual's health. And so we are seeing younger individuals with new diagnosis.
Dr. Green, World AIDS Day was created as a way to remember and honor the lives that were lost to the epidemic. But what do you think people, especially those who don't have, that living memory of what happened in the 80s, what are they losing, or what might they not understand about what happened at that time?
What we don't understand is my biggest fear, I think, what we're going to see. The lives lost, the destruction, not only for this generation, but for generations to come. There's decades of study of what it looks like after you ostracize certain communities. And so after you do it, there's the initial impact, but it's the mental, biopsychosocial impact that it's going to have decades on our children's children, right? That immediate pain of lives lost. We talk about it, how it was so terrible. Generations here don't know it. I actually don't want them to ever find out. And that's why it's important to advocate right now to reverse what's being done. It's a pain I wouldn't want anybody to ever know.
Dr. Hazra, how would you say the funding cuts under the Trump administration have impacted your work?
Greatly. I mean, and our story is not unique. We've been seeing, again, hundreds of millions of dollars of illegal cuts to research, to grants, to contracts that are, supporting the work of how to reduce new infections, how to link folks to care, how to provide preventative services, to implement those across the country. These are intentional cuts. These are there is major intention in what they're trying to dismantle here. And what is going to happen is, again, a lives lost. It's nothing short of a genocide, of really figuring out people living with HIV.
How would you compare the cuts of today under the Trump administration to the Reagan administration's handling of it in the 80s?
So I think Reagan just ignored it. Reagan administration did not say the word AIDS. They just pretended it didn't happen. This is far more intentional and far more insidious. This is actual active destruction of decades of work that has shown to be, again, hugely successful in preventing new diagnoses. This is the work of this administration is far more harmful than what the Reagan administration had done 40 years prior.
Manuel, what makes you hopeful about the activism and the advocacy of today?
I'd say the younger folks and their drive to push the needle forward, even though we are seeing the cuts. The younger individuals are being creative. How do we ensure that our communities have access to testing, to prevention, and to treatment? So seeing the drive of younger activists really gets me going. It really does.
Really quickly, before we run out of time, how are you commemorating World AIDS Day?
by being resilient, intentional, and dismantling the structural intent of other entities to stop funding.
Dr. Hauser?
Spent the day teaching medical students and seeing patients in the clinic. It's my way of service and how we can continue to push the needle forward.
Manuel?
Yeah, keep on fighting. I think that's how I will commemorate this day, is to keep on my advocacy and make sure that our communities are equipped to continue fighting forward.
That is a good way to do it, and where we'll have to leave it. Dr. Maya Green, Dr. Anu Hazra, and Manuel Hernandez. Thanks, everyone.
Thank you.
Thank you.
And that is our show for this Monday night. You can stream Chicago Tonight on our WTTW YouTube channel every evening and catch up on any programs you may have missed. And join us tomorrow night at 5:30 and 10. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, wishing all a happy and healthy holiday season.